Let's touch down on our health this morning. Majorly, we're going to be talking on something that relates to men. So we're exploring the complexities of male cancers in Nigeria. And we're doing that because I understand that June is a male cancer awareness month. Why are we focusing on it? Men. Of course, you know how it is. 2 days ago, we marked Father's Day, where we're thinking of how best to really care for the man who makes all things happen in our lives. But let me not be the one that will be able to bring this to you. My guest is already in the building, and he'll be talking us through this. Dr. Emmanuel Temitope Andero is a consultant clinical and radiation oncologist with the NSIA Youth Cancer Center right here in Lagos. Nice to have you in the building. Good morning, Dr. Andero.
Good morning, everyone.
And how are you doing?
I'm doing pretty well. Thanks for having me around.
It's your first time of being in our studios, I suspect?
Oh, yeah, absolutely.
Okay,
I've been pretty much around other places. So
okay, so look to your look to your left. You have the big screens there showing the roads. What do you make of it?
Oh.
What do you make of it?
Oh, looking pretty good. Looking nice. So, however, there are a few places that are a little bit tight.
Yeah, from what you can see there.
Yeah,
right? Do you drive around Lagos that much?
Oh, of course. Due to the nature of my job, of course, I literally drive around Lagos.
So is there any of those locations that you know?
Looking at the screen. Oh, well.
Okay,
well,
don't worry. Don't just go through that test.
Of course, they look quite very familiar.
Right.
So, yes, I can figure a few places.
Okay, let's just jump in on the conversation this morning. I'm not here to do a test for you or have a driver's license for you. But, Dr. Andero, let's talk about male cancers. And why is June designated as the Male Cancer Awareness Month?
Yes. Just like we have for, other cancers, like breast cancer for women, and also cervical cancer for women.
Right.
It is just but necessary to create a time whereby, we can create that awareness and pretty much of an enlightenment in order to be able to, let people know that, of course, there is a disease entity that is called cancer, which, of course, does not even spare men too.
Okay.
Right. So
it affects both genders?
Of course.
So what are some of the most common male cancers and how prevalent are they in Nigeria?
Great. Well, first off, let's talk about the disease entity called cancer. Many people, they don't really get to know about what is called cancer until maybe when they hear that, oh, Mr. A died of cancer or Mrs. B died of cancer. And for some, it is still that huge word that people don't really, have the understanding of what it is all about. Aside from maybe the common ailment as malaria, typhoid, this infection, that infection. Cancer is a unique entity. And, it has this, this tendency to kind of spread and grow.
That's right.
Now, what we're talking about some group of cells, which originally, of course, part of the normal cells, but due to certain factors, they go through certain transformations and become what I would call, quote, rebels. And then they continue to grow non-stop, proliferate non-stop, and then spread. And the goal of cancer is to overwhelm the system and ultimately to kill the individual. So that is why it is a global burden, not just in Nigeria.
So let's talk about the ones that affect the men. So what are the cancers that
affect men?
Yes.
Yes. The one that is the most common universally is prostate cancer.
Prostate?
Yes. Okay. So prostate cancer is the most common. And why it is so, prostate is, exclusively an organ found among male. And then it's also prone to cancer, and then, of course, not only prostate cancer, of course, we have other ones like testicular cancer.
Okay.
Because, anybody born biologically as male, of course, has those organs, and those organs too are prone to having cancer somewhere along the line.
So the testicles,
yes,
are prone to having cancer too?
Definitely. Ooh. Even the male organ, we refer to them as penile cancer. Penile cancer. But beyond all that, Men are also prone to having some other cancers.
Okay.
Yeah.
Like
so,
which one?
Of course, lung cancer. Of course, those ones are also, they are not unique to men alone, but of course, they are pretty common.
Ah.
Yes. And notably, lung cancer, colon or colorectal cancer, skin cancer, and those that we refer to as head and neck cancer.
All right. So
yes.
How common are these cancers that you've mentioned?
Yes. Well, not necessarily in that particular order as mentioned, but of course they are pretty common. And like I did say earlier on, prostate still remains the most common globally and is still one of the leading causes of cancer.
For men?
Yes, for men.
Okay.
And from, reports globally, an average of 1 out of 8 men are prone to having cancer, globally.
Prostate cancer?
Absolutely. Prostate cancer globally.
So if we have 10 men in this room, the likelihood of we having 2 of them coming down with prostate cancer is high?
Yeah, close to that statistics. Ooh. Correct.
That's huge.
It is.
But we rarely hear of penile cancer. We rarely hear of testicular cancer.
Yes, because they are actually very rare. So they are not so very common. But of course, we do find them in our practice in this part of the world as well.
So people show up in your clinic like that?
Absolutely.
What causes them? We know that we've been able to identify in this program that a lot of times they're not really easily discernible in terms of the causes. But doctor, can you just let us know what are the causes of all these cancers that affect men? Yeah,
you said it all. First thing we say, because it's one of the most questions that we come across in the course of our practice. And we do tell people that the causes are not known. However, there are what we call risk factors. So the risk factors are those factors that, if found among certain individuals, they have more tendencies of coming down with cancer. It is not an absolute statement that, having those risk factors, they are definitely going to come with cancers, but then their risk are much higher among the general population. And what are these risk factors? A common one, some are disease specific, like cancer specific, but then let's just talk generally. Those that are kind of common across the board.
Right.
And using prostate cancer as an example, which of course is, talking about male cancers, we can just even come down on that.
So what causes it?
Yeah. One of them is age.
Okay, aging.
Yeah, absolutely. Of course, it's a known factor that as men age, so the tendency to have cancers is, they are much higher. And prostate, of course, is also one of them. So, and it is known globally that prostate cancer is more common from, middle age upward, or say specifically from the 60s upward. Of course, in my practice, I've come across patients who are in their 50s.
And they have prostate
cancer. So aging is one of them. Others is
so it's not likely for a guy who's 35.
Absolutely, it's very rare.
It's very rare.
It's absolutely rare.
Okay, so it's age inclined.
Yes.
All right. What about testicular cancer?
Testicular cancer too, of course, is actually more common among a younger age group than other age group. And I said earlier, is pretty rare.
Yeah.
Yes.
In this part of the world, it's pretty rare.
Absolutely. Okay. And then, still talking about the risk factors for prostate cancer, race is actually among them. It is known that black race are a lot more prone to having a prostate cancer than the Caucasians.
A lot of times I've heard this from you professionals, and I begin to wonder why cancer is discriminating against we blacks. What's going on?
Well, of course, it is more of genetic, this is genetic predisposition that, when we all, carry certain genes in our system, of course, it can also predetermine what might happen to us along the line.
So we should go and question our ancestors' mutation, their cell mutation.
Yes, but I'll be quick to mention that there are also some cancers that are more prevalent among the white. Absolutely.
Like which one?
Of course, like skin cancers, for instance.
Okay.
Yeah.
And it affects them more than we
yes, affects and us. For obvious reasons. We the black men, we have these pigmentations. Our skin coloration protects us more against the ultraviolet light.
Okay.
Yeah, it's protective against skin cancers, and that is why in this part of the world, if I may have to kind of jump a little bit, for our own race who are also, who are also specially created, we call them albinos.
Yeah.
we see in our practice they are more prone to having skin cancers. If you look at the statistics in our practice, we discover that majority of skin cancers are found among the albinos. And that is why when I walk through the street or anywhere in Lagos or anywhere and I see them doing outdoor jobs, I always try to tell them that, hey, please,
you need to put down a lot of
absolutely,
protect.
or probably change job.
Right.
Because they are more prone to having,
All right, so let's begin to look at the symptoms and some of the signs that would show that this man is coming down with any of these cancers that you've mentioned. What are some of these signs?
Yes. Like I said earlier as well, some of those symptoms and signs are disease specific.
Okay, so let's talk about for prostate, for instance.
Prostate, yes, because which is the most common. At the initial stage, it is asymptomatic, like we say, meaning the patient would not even come down with any sign of symptoms. But then as the disease progresses, then the patient may begin to witness some symptoms or the other. Chief among them, are urinary symptoms, in which case a man may notice that he pees more frequently.
Okay.
Of course, peeing frequently is not saying, it's not to say absolutely that someone is having prostate cancer.
All right.
But might be, a kind of a signal for proper screening. And of course, still talking about urinary symptoms, some may notice some blood in their urine, or maybe after an ejaculation, having activities with their partners.
Right.
And some might have to wake up late night to pee more frequently. And at a certain point, because it's a spectrum, if nothing is done at some point, such individuals might have an absolute retention.
So will not be able to pee.
It's total shutdown.
Wow.
And could become an emergency in which such a patient might have to be rushed to hospital for an intervention. Now, and then as the disease progresses, of course, the natural tendency for any cancer, as mentioned earlier, is to spread. It can then begin to spread to some other part of the body, and at this time, there can be manifestations of other symptoms. It can be like bone pain. In this case, maybe it has infiltrated the bone, the spine, the waist bone,
right,
and all.
Wow.
And at this point, at the local setting, people can be saying, okay, maybe it's JD. They are taking some herbs and all that. And it is not uncommon.
So is it connected to the waist pain?
Absolutely.
You mean it?
Absolutely.
Because a lot of times people come down and say, look, I have a lower back pain. It's because of what I took. I've been drinking too much and all of that. So you're saying that it could just likely be a symptom of a prostate?
But I will be quick to say as well that having back pain is not to say an individual is having prostate cancer.
Okay.
But, in effect, if the cancer has spread up to a level where it has kind of spread to the bones, the backbone especially, because that's a natural route of spread, the spine, the waist, the pelvic bone, like we call them. So one of the manifestations are kind of low back pain, waist pain, and at some point, if nothing is done, it can result into what we call pathological fracture, in which all those weight-bearing bones will just cave in, and the person might find it difficult to walk.
Wow.
Yes. And then it's not uncommon in our practice when some people are brought in on wheelchairs or stretchers, and they are paralyzed. And some could have attributed that to, okay, maybe the enemies in my office, or maybe the next door neighbor, or because I fought with Mr. So and so.
Right.
Somebody put something on the follow. But then it is when they come around, we now run relevant investigations to realize that,
find out.
Yes, the PSA is touching the roof.
For colorectal cancer, what are the signs that will show?
Yes. Also for colorectal cancer, at the initial stage, it might not present with any significant symptoms, but of course, as it progresses, there will be certain symptoms, even as little as, excessive gassing, right?
Oh.
But that is not to say gassing is...
That's farting, right?
Yeah, that is farting. So that is not to say when you fart, you think, okay, maybe I'm having colon cancer. Then there can be regular bowel movement.
Right.
Could be some intermittent constipation and diarrhea. And some might notice some blood in their stool. And for some, it could be some kind of occult blood, like we say. It's not so obvious for people to see. But then what they might see is that there could be this, a gradual drop in their blood count for unexplained reasons.
Ooh.
In this case, it could be from the cancer, whereby the blood is just trickling little by little, and the person has, some kind of chronic anemia, unexplained anemia, and then weight loss.
Right. Is that also related to age as well?
Absolutely. Well, what we say is related to age, but of course, colorectal cancer can also be found among people in their 20s and 30s.
Wow.
Yes.
Wow. Okay, so what are we supposed to do as males? What's the advice, from the Lute Cancer Center? What's the advice you guys are giving to all men this morning?
Yes, thanks very much. And, I want to give credit to this radio station and the anchors for doing this great job. If we could have many more of these kind of programs in the country, then we are going to have less burden of cancer, in this country. Because having a program like this will further enlighten some people and increase their knowledge about, the awareness that certain disease entity exists and what to do in order to have what we call early detection, which of course can impact the overall survivor. Now, what every man should do the moment you are reaching any age from 45 and above, there has to be regular screening for prostate cancer. How do we screen? There is a test called PSA, which is prostate specific antigen. Okay. Now this is a special
kind of test.
Yes, the prostate kind of secrete what I might say, for better understanding, certain chemicals.
Okay.
Now, it has a range. So, and if you are tested and then it is beyond the normal range, it can be very suspicious for...
What's the percentage? Beyond what percentage?
The range is 0 to 4.
Okay. So
yes.
Anything beyond 4 is a red flag.
Yes. Well, if it is, it can be 5, 6 or thereabout due to certain reasons aside from cancer. But then the doctor has to explore and let you know that, okay, it is still benign or not cancerous. So now, and it's even more so if there is a family history of prostate cancer. If my father had prostate cancer, I'm more prone to having prostate cancer. So it even makes it more imperative for me to make myself available. I mean, anywhere from that age of 40 and above.
Wow.
And the black race too.
This one says, there's a message here that says, good morning, Victor. What is the one simple step any man can take to reduce his cancer risk? Fola from Bagada. I think doctor has just touched down on that one.
Yes.
Another one here says, good morning. Can cancers be completely cured, or is it more about managing it long term?
Okay. So maybe I should start with the second question.
Mm-hmm.
Yes. The person has said it all. So we tell our patients that because of the natural tendency of cancer, we don't use the word cure. Rather, we talk about management.
Okay.
It's more of a lifetime management. However, cancer could be driven into a state of remission, whereby all the symptoms a patient will have presented with originally, yes, could be dealt with, and there could be absence of those symptoms, both the one the patient can see and even when we do some what we call radiological investigations,
right,
and then it could disappear. However, there's that tendency that the cancer might recur over time. It is pretty much like what I tell my patient in my practice is, I say, okay, just look at it like when high blood pressure is being managed,
right,
we use the word manage, because you see, when
you can't say it's totally cured.
Absolutely.
All right, but I know on this program I've spoken to some of your colleagues, especially for the cancers for women, and I know they've talked about cervical cancer being totally cured. How come no male cancer can be cured?
Yes. Well, much as I wouldn't want to say anything to the contrary, so there are certain facts I might want to establish.
All right.
Now, I'm talking about certain cancers being cured, especially among women. I mean, it's also within the confines of my practice that I do on a daily basis. The most common cancers among women in this part of the world, breast cancer is one, and it's even global.
Right.
But in this part of the world, the next in rank is cervical cancer. Now, let me talk about cervical cancer. We may use the word cure for cervical cancer in the course of doing the screening called pap smear. If it is noticed right on time at the pre-invasive level, it means before the cancer encroaches deep down. Yes. So at that point, we can talk about cure. But then when the cancer has already become invasive, we don't talk about cure.
All right,
this one says,
good morning, Mr. Victor and Dr. Emmanuel. My father and some of my uncles have or had prostate cancer. Am I doomed to have it too? B from Ogba.
Oh, is B male or female?
B is a male.
Oh, okay, yes. B.
B.
Oh, okay.
Yes.
B. Well, your chances of having prostate cancer is much higher than someone whose first degree relatives don't have it. But that is also say in absolute time that you are going to have it. My advice is that you make yourself available for early screening, for early detection.
All right.
Yes.
Okay, then. Let me just quickly run through some of the messages so that we can round up the program.
Yeah.
This one says, apart from frequent urination, what other symptoms of prostate cancer should I look out for?
Yes. As mentioned earlier, I talked about, urinary symptoms. And aside that, what comes up now depends on how advanced the disease is. Now, if at the early stage of having urinary symptoms and it is ignored, it then might progress to a point where now it has encroached into the surrounding structures.
Right.
And at that point, someone might begin to have some pains around the waist, around the back. And there are times when it can even infiltrate to the back posteriorly into the rectum, whereby some people might even begin to see some blood in their poo.
In their poo, okay.
Yeah, at some point.
All right, so the cost of treating cancers is very expensive.
Absolutely.
So what is the government doing to help the common man? You didn't put your name, but thank you so much. Maybe that would be the last question I'll allow Doctor to answer this morning. So what can be done in terms of treatment?
Yes. Well, I want to give credit to the government. In there are only two ways they're actually trying. It is an enormous task. And in any society, the government has a pivotal role to play.
Okay.
Regarding healthcare delivery to the population. But what we can say is that the government can still do more.
Okay.
So I think the government is putting up some effort here and there to partner with individuals and corporate organizations.
Let's begin to round this off.
Still do more.
Let's begin to round this off right now, Doctor. I know that time is not really our friend, but what's the message to all men out there? So even though we're endangered species, so to say, but then what's the message as it relates to cancer this morning?
So the take home this morning is that we all should make ourselves available for screening.
How often?
Yes. Well, for prostate specifically, from age 40-45 and above, PSA of every year is recommended, and then what we call digital rectal examination, whereby doctor has to stick his finger into your anus.
Wow.
Yes, that too has a role to play in
knowing the size of
the... and then that can signal, something is going on, and then doctors can run a biopsy, we call it biopsy, where we have some deranged result,
right,
in order to confirm the diagnosis. And then for colon cancer, colonoscopy is also very much advised. For those with history of colon or colorectal cancer, we advise as early as 45 and above, but without history from 50 years and above, once in 5 years or once in 10 years.
All right. We'll leave it at that for now, Doctor. I wish we had all the time so we can explore all aspects of these male cancers. And I think we need to return. Today is what, the 17th? Maybe before the end of the month, we can still do something on how we men can really, really take care of ourselves.
Absolutely.
And not allowing the women to steal the show.
Yes.
All right, then. It's nice having you in the building. Thank you so much for being here.
Same here.
All right. So we've been exploring the complexities of male cancers in Nigeria, and Dr. Emmanuel Temitope Andero, who is a consultant clinical and radiation oncologist with NSIA Luth Cancer Center, has taken us to the classroom. A brief break. When we return, we're going to be transporting you to Lekki this morning, because we're going to be looking at the Lekki e-call-up system in terms of enforcement and, of course, matters arising.